This is a presentation of results from the first ever survey of surgeons using the laser in cataract surgery. I'd like to acknowledge Michael Lockman, my co-author, who was invaluable in the data analysis. We invited 46 lasers that had been installed by the end of last year to participate in the survey, and we received data from 30 of them, encompassing 63 surgeons. This was a very good response rate. Average time of use with the laser was 6 months, and close to 6,000 laser cases are represented in this survey. So you can see the surgeons participating average doing 850 cataracts per year, and their activity in the premium cataract channel is a combined 23%, which is slightly higher than the norms reported in Market Scope of 15%, but to be expected when you think about the early adopters who are the first ones to get the laser. The penetration in the premium channel is one of the key questions that people had in terms of what the impact of the laser would be. We see with the toric IOL a very slight decline in procedures, not meaningful, and we see with the presbyopic IOL actually an increase of a full point or more, which may be a sign of synergy used with presbyopic IOLs and lasers to achieve the best outcomes, but admittedly it's still too early to make that call. A second question of interest was whether or not the laser would cannibalize use of premium IOLs with patients who want refractive cataract surgery. The answer is no, with the majority of all premium cataract procedures being performed with the laser when we measured Q1 2012, which was the purest time frame to use. You see that 70% of presbyopic and 42% of toric IOL implants are done in conjunction with the use of the laser. Another question that's being asked is how quickly do surgeons and practices use the laser with cataract surgery once it's installed. And you can see a fairly quick adoption rate showing that by 2 to 3 months of usage, 20 to 30% of all cataract procedures are using the laser. The trend line shown in purple really predicts that out over the long term, 30 to 40% of all cataract procedures will be using the laser, at least from the data set we have here. And when we repeat this survey next year, we'll have that many more installs of which we can really do a better job with this trend line. But we think this is fairly accurate based on our conversations with individual centers. Centers use a variety of tiers, if you will, to create their refractive packages. Prior to the advent of the laser, there were really 3 tiers, and surgeons used either 2 or all 3 tiers. With the laser, we have an expansion of refractive services and a wide variety of approaches in terms of how to package this for consumers. It goes from one end of the continuum, where you have surgeons using just a single tier and one price for everything they do, to as many as 6 tiers. It's not just about the laser. There is an entire portfolio of non-covered diagnostic tests that are being performed, as well as services as part of this refractive cataract offering which has emerged. And perhaps most importantly, people want to understand the impact on volume and the impact on fees. And what this slide shows us is that, first of all, 13% of all the conventional IOLs are now using the laser, in addition to 42% of toric and 70% of presbyopic. And if you look at the numbers at the bottom of the table, you can quickly see that a small slice of a very large pie in the conventional IOL realm outweighs a large slice of a smaller pie. The average fee that's being charged when you blend it across all IOL types and you include the fact that some practices did not raise their fees in the upper tiers of their offering is a $945 average change in fee from before having the laser to the new world of refractive packages with the laser. When we asked surgeons to tell us how happy they are with the use of the laser, we actually see very strong agreement with a number of statements that we pose to them. It's clear that the staff and patients have well embraced the technology. If anything, we see, because of the difference between strongly agree and agree, in things like optometric education and impact on patient flow, we could argue there's a little bit of room or some room for improvement there. But I think the big story here is that surgeons are generally happy with the technology, and you don't see strong disagreement with any of the statements in this list that we asked. And that leads to the final question we asked, which is what people would recommend to their peers. And 92% would recommend the technology, with 63% saying go for it now, and another 29% saying, it's a good thing to do, but you got to understand it's going to take longer. There's a lot of work. You really need to be organized. And we at SM2 agree with that sentiment that you really do have to have your systems in place before you get started. 8% said no, they would recommend holding off and waiting until there's more outcomes data on the technology and its impact on cataract surgery. We did come across and identify one significant issue as we're getting started here that needs to be resolved. Of the 30 centers that participated, 29 different names for the procedure are being used in how they describe it with patients. There were only 2 names in this list that were used by more than one center. This is an issue that needs to be addressed, and SM2 Strategic will be publishing articles on this and other marketing and business aspects of the technology throughout 2012, so stay tuned. We also did a break-even analysis based on the numbers from this survey, the actuals, as well as our understanding of what manufacturers are charging for lasers. And basically, to own a laser, the tipping point occurs for a practice that does about 900 to 1,000 total cataracts a year. They should be able to convert 250 to 300 of those to the laser, and using the cost that we're aware of, that becomes the break-even point where everything above that becomes profit when you use a 5-year analysis. On the flip side, for a doctor seeking to use a laser on an open access basis, it's a very simple equation. It's just the marginal cost that they would have to spend above and beyond the disposable that would be paid to the manufacturer to use the laser, using an average fee increase of $945 per eye. Now finally, we just want to say that if you are seeking to purchase or considering purchasing a laser, feel free to get in touch with us to see how we can help you in that decision process. And similarly, if you'd like to get the heads up on these reports in the future, if you're already not on our subscription list, you can join by joining the Premium Experience Network at our website, sm2strategic.com, or following us on Twitter equally as well. Thank you very much. On behalf of everyone at the SM2 Strategic team, I'm Shareef Mahdavi, and that's how I see it.